Hey, my name is Ashley, and today I'm going to do a head-to-toe assessment on my patient, Samuel Thomas. He is a 33-year-old male, has no family history, no medical history, no surgery history. He does not take any medications daily or over the counter. He does have a penicillin allergy, which causes a rash. He is clean, very friendly, no odor. He is appropriately dressed for age and weather, and his posture is to inspect the hair. I don't see any type of infestation. The head is symmetrical. I don't feel any masses or lumps. Inspect your face. Some facial hair is noted. I don't see any lumps or lesions or anything. There is some freckles. Okay. Okay, so the trach is midline. Okay, so I'm going to press on your sinuses. If you have any pain or tenderness, you just let me know, okay? Any pain or tenderness? Okay. And what about down here?
Nothing.
Okay, perfect. Okay, I'm going to check your carotid. Okay, and this side. Okay, carotid is equal bilateral. Okay, and I'm just going to assess your temporal artery here. Okay, and they are equal bilateral. Okay, I'm going to assess your lymph nodes. So the preauricular, postauricular, occipital, and submandibular, submental, the cervical chain, and the supraclavicular. Okay, and no enlarged lymph nodes, no masses or anything noted. Any pain or tenderness with that? So now I'm going to inspect your eyes, okay? So I'm just going to have you look straight forward for me, okay? And I'm just going to look at your eyes. Okay, pupils are about a 3 and then they turn to a 2 with light. Perfect. Pupils are equal and reactive to light and accommodation. Let's see. So his eyes on just appearance, his eyes are red around the sclera. The conjunctiva is a little pink. Okay, and now we're going to do your 6 cardinal positions of gaze. Okay, so I'm just going to have you follow this pin light with your eyes only, okay? Okay, perfect. And now I'm going to test your peripheral vision, okay? So just tell me when you can start to see the flashlight again, okay?
Yeah.
Okay, and on this side?
Yeah.
Perfect. So now I'm going to assess your ears. Just looking at it, I don't know any wax buildup on the outside. I don't know any masses or lesions or anything on the outside of the ear. So now I'm going to take my otoscope and I'm going to pull his ear up and back at the pinna, and I'm going to look through. Okay. So I note the tympanic membrane to be pearly gray at 5 o'clock. No earwax or fluid. Okay, and now I'm going to assess this side. Okay. Pull his ear up and back at the pinna and look through with my otoscope. And it is pearly gray at 7 o'clock. No fluid buildup, no earwax buildup. On the outside, I don't see any lesions, masses, anything. So the septum is midline. I don't notice any deviation or anything just off looking at it. Okay, so I'm going to have you lean your head back for me, and I'm just going to look inside your ears. Okay, so hair is noted. The membranes and turbinates appear intact. It is moist and a little red in there. Okay, so what I'm going to have you do is hold one side of your nose and breathe in and breathe out. Okay, and your other side. So patency is normal. So I have already used hand hygiene, put on a new pair of gloves. I'm going to inspect the mouth. Lips look moist, red. I don't see any cracks or ulcers or lesions or anything. Okay, so I'm going to have you go ahead and open for me. Okay. And when's the last time you seen a dentist?
Last year.
Okay. And do you normally see them regularly?
Yes.
Okay. So I don't notice any cavities or any lesions, ulcers. So now I'm going to inspect your tongue. If you'll stick your tongue out for me. Okay, and open wide for me. Okay, and I'm going to lift up your tongue. Okay, and I don't see anything underneath the tongue. Perfect. Okay, and stick your tongue all the way out for me. Say ah really big.
Aww.
Okay, and I see the uvula. So press open for me. Okay, so hard and soft palate are soft and pink, no lesions or ulcers noted. So I'm just going to inspect back here. Okay. So I do see some suspicious lesions that you do need to get checked out. Let's see. Okay. And go ahead and take a deep breath for me. Okay, and normal chest expansion noted. Let's see. Okay, so I'm going to go ahead and listen to your lungs. Okay.
Mm-hmm.
Go ahead and take a deep breath for me. And again. Again. All right, so lungs are equal bilateral. I don't hear any wheezes, crackles, no striders. Okay, and now I'm going to assess your spine for some tenderness, okay? So I'm just going to palpate your spine, and if you have any tenderness, you just let me know, okay? Okay, any tenderness with that? Okay, so now I'm going to assess for CVA tenderness. Which basically just means that I'm going to assess your kidneys for any tenderness. So I'm going to place my hand on you and I'm just going to barely tap it, okay? You tell me if you have any tenderness, okay?
Okay.
Any tenderness?
Mm-mm.
Okay. And this side? Any tenderness? Okay. Good job. Okay, so now I'm going to listen to your lungs, okay? And just take a deep breath in and out for me. Okay. And deep breath. Okay. And no adventitious breath sounds on right upper, right middle, or left upper. No any labored breathing. The chest is symmetrical. Okay, so now I'm going to have you turn around so I can palpate your spine. Okay, I'm going to have you bend down for me and try to touch your toes. Okay, and I'm just assessing the spine. I don't see any kyphosis, lordosis, or scoliosis. You can bend back up for me. All right, now we're going to do a couple cardiovascular things, okay? So first of all, I'm going to check your fingers, okay? So I don't see any bruises or lumps, anything abnormal. So I'm going to check your capillary refill, okay? Capillary refill is less than 2 seconds, okay? I'm going to check your skin turgor, okay? And normal skin turgor. Okay, you can just relax your arms down for me. Let's see. Let's try to locate your PMI. Okay, PMI is where to be expected. Okay, so I'm just going to listen. Okay. And this is your aortic valve, and that is S2. Pulmonic valve is S2. Tricuspid is S1. And mitral is your pulses. This is your brachial. Okay, you can just kind of relax for me. Okay, brachial pulses are equal bilateral. Okay, and I'm going to check your radial pulses. And they are equal bilateral. Okay, I'm going to look at your hands one more time. Okay, I don't see any clubbing of the fingers or the fingernails. So now I'm going to assess your abdomen. So just looking at it, I do note freckles, I note some hair. The abdomen is symmetrical. So now I'm gonna also take your bowels, okay? So bowel sounds are hyperactive. Did you just eat?
I did.
I can tell. Okay, so now I'm going to percuss your abdomen. Okay, so I do note tympany in the left upper quad and dullness in the other 3 quadrants. I'm going to palpate the abdomen using light and deep palpation. Okay, so you just tell me if you have any tenderness or pain with light palpation first, okay? Okay, any pain or tenderness? Okay. All right, now I'm going to go a little bit deeper, okay? You tell me if you have any pain or tenderness, okay? Any pain or tenderness? Any pain or tenderness? Pain or tenderness? Okay, so no pain or tenderness noted on light or deep. Inspect your lower extremities, okay? So we hold them together. Okay, so the lower extremities are symmetrical. Okay, and I do note hair and nothing abnormal noted. We were going to assess the femoral pulse. We would check it right here in the groin area. Okay, and we're going to assess the popliteal pulses. And they are equal bilateral. Okay, we're going to do your posterior tibial. And those are equal bilateral. Okay, and we're going to do your dorsalis pedis pulse. And those are equal bilateral. Okay, so we're going to do the Babinski test. Usually I would have an instrument for this. This just makes sure that their toes curl in. Okay, and we'll do this one. Okay, so I'm going to check your capillary refill in your toes. Okay, and both of them are less than 3 seconds. Okay, and now I'm just going to assess for any edema or tenderness. Any tenderness with this?
No.
Okay, and no edema is noted and no tenderness is noted. Okay, so now I'm going to have you to remember these 4 words for me. Cat, dog, shoe, picture. Can you repeat them back to me?
Cat, dog, shoe, picture.
Okay, so later on in my assessment, I'm going to have you repeat them to me, okay?
Okay.
Can you tell me what you had for breakfast today?
Biscuits and gravy.
Okay, and can you tell me what your first car was?
Mustang.
Okay, so now we're going to do some sensation, okay? I'm going to start with your face first, okay? So just close your eyes and tell me if you feel sharp, dull, or soft, okay?
Okay. Dull. Soft. Sharp.
Okay, and now I'm going to go down to your lower extremities.
Sharp. Soft. Dull.
Okay,
Dull. Soft. Dull.
okay, and if you'll just stretch your legs out for me. And still keep your eyes closed.
Soft. Sharp. Dull.
Okay, so for this test, I'm gonna have you to do finger to finger for me, okay? Try that with both of your hands. Perfect, okay, and I'm gonna hold my finger right here. What I need you to do is to take your finger, touch your nose, and then come back and touch my finger, okay?
Okay.
Perfect, and do it with your other hand for me. I'm gonna have you to take your heel and rub it on your shin for me, and then you're gonna repeat it with your other leg for me. Perfect, okay. And I'm gonna have you to squeeze my finger for me. Perfect. Hand grip is equal by test your deep tendon reflexes, okay? So I'm going to take your hand and just kind of relax your arm, put all your weight on my arm. Okay, so first of all, we're gonna test your triceps. Okay, and you can just flip your wrist over for me. We're gonna do your bicep. Okay, and then we're gonna do your brachial radial. Okay, and then you can just relax your arm down for me. Okay, and if you will just kind of stretch your legs out for me just a little bit. Perfect. Okay, and I'm going to, cross your legs for me. Okay, and just kind of relax your leg, and I'm going to check your patellar reflex. Okay, and do the other leg for me. Okay, and you can just put your legs down for me. Okay, so now we're going to do the Achilles. If you'll hand me your foot. Okay. Okay, and let's do your other one. Okay, we're going to test your cranial nerves. Okay, so I'm just going to have you do a couple tests for me. All right, so try to shrug your shoulders with resistance. Perfect, okay. Let's see. So I'm going to have you to taste this and tell me what it is, okay?
Cherry.
Okay. And close your eyes and tell me what the smell is.
Peppermint.
Okay. And I'm gonna have you take a little sip of this water for me so I can watch you swallow. You can open your eyes. Okay, so swallowing is intact. Okay, and I'm gonna have you close your eyes and tell me where I touch you at, okay?
Cheek.
Okay, have you stick your tongue out for me. I'm gonna check your gag reflex. Okay, gag reflex is intact. Okay, so I'm going to hold resistance against your jaw, and I'm gonna against your chin, and I'm gonna have you try to press your mouth open for me. Perfect. Okay, and try to move your jaw to the opposite side for me. Okay, and same thing on this side. Perfect. Okay. So I'm gonna have you cover up this ear here for me, and I'm gonna do a whisper test. Then you just tell me what words you hear. Okay.
Cat, dog, picture.
Okay, and we're going to cover up that ear for me.
Yellow, purple, red.
Okay, so hearing is intact. Okay, can you smile for me? Okay, and raise your eyebrows. Okay, so I'm going to have you close your eyes for me and try to keep them closed while I try to open them. Okay, perfect. Perfect. Cover up one eye for me. And can you read this here for me?
I love my mommy because we have so much fun together every day.
Okay, and cover up the other eye for me and read this page for me.
My mommy is snuggly and soft, and she always cuddles me tight.
Okay, so I'm going to have you stick out your tongue for me and move it side to side. Perfect. Okay, and can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, perfect. And can you tell me them 4 words that I had you remember earlier?
Cat, dog, shoe, picture.
Okay, now we're going to do some range of motion. So I'm going to have you to shrug your shoulders for me. Perfect. Okay, and tilt your head to the side for me. And to the other side. Perfect. Okay, and with your wrist, rotate them in a circle. Okay, and bend them down. and bend them up. Perfect. Okay, and your ankle, point it downwards. Perfect. Point it upwards. Perfect. To the side and to the side, and do it in a circle for me. Great job. All right, let's do your other leg. Same thing. Point it down, point it up, to the side, and circular. Perfect. Okay, and can you bend up your knee for me? Perfect, and let's do your other knee. Good job. Okay, and bend up both of your arms for me. And back down. Good job. All right, so flip your wrist. Good job. Okay. Do side to side for me. Good. Okay, and let's do tandem walking. So you're gonna do heel to toe for me, walking in a straight line. Great job. Okay, now we're gonna do the Romberg test. So I'm gonna have you stand on one leg for me with your hands out by your side and your eyes closed for me. Great job. And I'm just assessing for any swaying, and I don't see any, so that's great. Okay, you can stop. So now we're going to do some range of motion of your spine and your hips. So I'm going to have you to bend both ways. Perfect. Okay, and then turn side to side for me. Good job. Yep. Okay, so now I'm going to teach you how to do a self-breast exam. So standing in front of the mirror, you want to put your arms on your hips with your shoulders straight. Looking at yourself in the mirror, you want to check for any bulging of the skin, nipple discharge, nipple drainage, redness, swelling, anything that you notice that would be abnormal. And then you're going to raise your hands up and do the same thing, assess for any redness, swelling, discharge, any lumps or masses if you notice anything, any dimpling of the skin. The next step you can do either in the shower or laying down, whichever one's more comfortable for you. You want to raise your right arm above your head, take your left hand, and you're going to use 2 or 3 fingers, your pads of your fingers, and you're going to go in a circular motion, and you want to do it vertically, and you're going to start from the axillary area all the way down to the top of your abdomen, and then you're going to go all the way across the breast. And then you're going to do side to side into the axillary, because you have lymph nodes up here that you want to check as well. Make sure you don't feel any swelling or enlarged lymph nodes. And then you're going to do it side to side as well. And then you're going to do the same thing with this arm. Take your right hand, the pads of your fingers, and you're going to go in a circular motion all the way across. You want to do this once a month. You can do it 3 or 4 days after your period, or if like you like a Wednesday better, a certain time of the month, whichever one is easier for you to remember. Do it once a month.